this lesson, you will learn 3 important skills. First, you will learn how to measure the head, abdomen, and femur to find fetal age. This involves learning how to find the correct level for each structure. Finally, you will learn how to choose the best ultrasound images to determine fetal age in the 2nd and 3rd trimesters. Many women don't know their last menstrual period, so ultrasound can be very helpful to determine the age of the fetus. Accurate dating is helpful to manage a normal pregnancy and determine if a birth occurs too early or if the pregnancy continues much after the due date. It is also essential to determine when you can safely do a cesarean section so that the baby is not born too early. Using fundal height alone to date the pregnancy can give a false due date in the case of twins or with increased or decreased amniotic fluid. Ultrasound can easily identify these conditions. Note that first trimester dating is more accurate than dating performed in the 2nd and 3rd trimesters. Remember to never change the gestational age or due date later in pregnancy with a second ultrasound if you've already obtained dating with an earlier ultrasound. In the first trimester, we use the mean gestational sac diameter and crown rump length of the fetus to date the pregnancy. We will discuss how to do this in a future lecture. In the 2nd and 3rd trimesters, we measure the head, abdomen, and femur. Remember that we never want to use images that aren't the best possible. Sometimes images aren't optimal because there is decreased amniotic fluid or the fetal position is not ideal for the measurement. To be most accurate, it is best to measure each structure at least 2 times. When measurements are entered into the OB worksheet on the ultrasound machine, the machine will calculate the gestational age and estimated due date. Older machines may not have obstetric software packages. In this case, you can use charts to get the dates for individual measurements. The charts have the same information that is used by the ultrasound machine. We will start with measuring the head. We will learn 2 ways to do this, by taking the biparietal diameter and the circumference. Diameter is the width of the head through the middle. Circumference is the measurement around the outside of the head. Remember that we talked about the brain at different levels in the anatomy lecture. The biparietal diameter, or BPD, is in the middle of the brain at level B. Measuring the biparietal diameter accurately involves 4 steps. First, you must measure at the level of the thalamus and cavum septum pellucidum. Make sure that the entire skull looks smooth and oval and that the brain structures are equal on both sides. Measure from the outer edge of the skull to the inner edge. The line between the cursors should be perpendicular to the falx. The 2 most important factors in getting this measurement right are finding the proper level at the thalamus and CSP and seeing that the head looks oval in shape. It is more important to clearly see the thalamus than the cavum septum pellucidum. We will now show you 4 examples. This is a transverse view of the head. The cavum septum pellucidum is towards the front of the head. Notice that the CSP looks like 3 white lines here. The thalamus is near the middle and has a heart shape. The falx is a strong white line that is in the middle of the head, but at the correct level to measure the BPD, the falx does not run continuously from the front to the back of the head. The falx should not be visible in the back half of the head. The head can be in various positions. It is most important that the head be oval in shape and to scan at the level of the thalamus. Here is the thalamus. The CSP is also present here, but less distinct than in the previous image. The image on the left is a fetus at 22 weeks, and on the right, a fetus at 32 weeks. The cavum septum pellucidum looks somewhat different in both images. We have outlined the CSP in both images to make it more obvious. On the left, it looks more like a black box than 3 white lines. Both images are accurate levels for BPD. Can you find the thalamus in each image? Please pause the video now to invite the group to find the thalamus in each image. Once you have good head position, you can now measure the BPD. We want to measure from the outer edge of the skull to the inner edge. It is very important to be precise. If the measurements are not precise, the gestational age estimate will be wrong. Here is another image to identify the falx, cavum septum pellucidum, and thalamus. Please pause the video now to identify each of these structures. We have outlined these structures here to make them more obvious. The line between the two calipers should be perpendicular to the falx at the widest portion of the skull. In these measurements, the lines between the calipers are not perpendicular to the falx. The measurements will be incorrect. This fetus is only 15 weeks and 5 days. Can you see the thalamus and CSP? Please pause the video now to look for these structures. It can be very difficult to see the CSP before 18 weeks. Note that the dashed line representing the measurement of the BPD is perpendicular to the falx. The calipers are located on the outer and inner edge of the skull. Here's another example of how the BPD measurement is perpendicular to the falx and the calipers are located on the outer and inner edge of the skull. The image also shows you how the BPD and gestational age will look on the computer. We see here that the BPD is 6.27 centimeters, which means that the fetus is 25 weeks and 3 days old. Another way to judge your image is by looking for ventricles. Ventricles are seen best at level A. Ventricles are near the top of the head. Please note the lateral ventricle in this image. Ventricles contain fluid and tissue that makes fluid. The fluid is black, and the tissue that makes fluid, the choroid plexus, is echogenic and bean-shaped. This plane is too high to measure the BPD, so the measurements will be falsely small. Notice that the falx is continuous. Anytime the falx is continuous, you know the level is wrong to measure the BPD. You also cannot see the thalamus or CSP. Can this image be used to measure the BPD? Please pause the video now to discuss within your group. The answer is that this is the wrong level to measure the BPD for several reasons. The level is too high because you can see the ventricle and choroid plexus. The falx is almost continuous, and both the thalamus and CSP are missing. Please pause the video now and ask for a participant to identify the thalamus and CSP. We have outlined the CSP and the thalamus here to make the structures more obvious. What is this structure? This is called the cerebellum. It is at the back of the brain. If you can see the cerebellum, you know the level is too low to measure the BPD. The cerebellum is at level C, which was the level of the last image. This is another view of the cerebellum. Look for the shape of a very fat 8. We have outlined the cerebellum here to make it more obvious. This is the correct level to measure the BPD. We cannot see the cerebellum at this level. Notice the correct placement of the calipers to measure the biparietal diameter, one on the outer and one on the inner edge of the skull. The dashed circle on the outside of the head measures the circumference, which we will talk about next. It is okay to have both of these measurements on the same image. The guidelines for an ideal image are the same to measure both the BPD and head circumference.